The VA and veterans hospitals nationwide are currently criticized for falsifying medical reports, long waits for appointments for some veterans, and others not receiving appointments at all. Joining me to discuss this issue and how Minnesota is faring, we have the chair of the State Department's and Veterans Division, Senator Tom Saxhaug. Thanks for joining us on this topic.
Always good to be here, Julie.
Senator, let's begin with the broad scope of this issue. And, some veterans have waited more than 90 days for appointments. That seems to be the national average. Some have even died while waiting for appointments. Former VA Secretary Eric Shisekki, resigned over this scandal, and he did say that there's a lack of integrity throughout the network. Do you think there's a lack of integrity in Minnesota's VA system, understanding it's a federal issue?
Well, yeah, and let's go back to the fact, as we always say, that we've got to take good care of our veterans for the things they did for us. And, we remember this, the 70th anniversary of D-Day and the like. And I do think that the spotlight was on Arizona at this time of the year. I just sit back and think, well, what's Arizona? How is Arizona different than Minnesota or any other place? Well, there's a time of the year where the migration of older people and veterans goes to Arizona. And I'm sure that that's part of the problem, is that there's just so many older veterans there that that's a problem. That's not an excuse. That's just what I think could be one of the symptoms.
Good perspective.
But the Minneapolis Vet Home right now is ranked as a 1A facility. It was ranked as one of 3 in the country that are 5-star. We don't have long wait times, or at least they're much below normal. And we've got a large investment starting with the bonding bill last year that we're going to increase the size and remodel parts of that nursing home. So I feel really good about Minnesota and where we stand with veterans.
And yet the Minneapolis and Rochester VA hospitals will receive further review from the federal government. So how closely will you be watching this audit?
Well, I will be watching it because I think it's important for the state of Minnesota to if indeed the story that we're getting is not the truth, then we need to do what we need to do to get things together. The other thing that I've got to say, though, is that we passed this $19.9 million renovation bill out of our bonding bill. We've yet to see the federal money. That's kind of a symptom of what's happening nowadays, too, is that Washington doesn't function the way Minnesota does. We put out $20 million, saying that, we're waiting for that match, and we haven't received the match yet.
And so given that, Senator, overall, what do you think is your role and the role of the state in trying to resolve some of this crisis? What can we do here?
Well, one of the things we did this year in the legislature is we appropriated $250,000 to do up to 5 grants to do nursing home studies in communities throughout the state for possible needs for veterans housing. We're trying to come up with, and the second thing we're really trying to do in Minnesota is, in rural Minnesota, sometimes it's very difficult to get to a veterans home. Even when you're on the waiting list, you're going to have a snowstorm. It's a long drive. And sometimes there isn't transportation available, and these vets can't drive. So we're looking to make it easier, and this was mentioned on the federal level too, easier for local hospitals if they need to treat veterans, and for veterans to be able to go to local hospitals.
And that was actually my next question. Is that a proposal you would support, to let veterans seek their any kind of medical attention they need outside of the VA system?
Well, I think that we need to, I don't think loosen up is particularly a good word, but if there's something that, like an annual physical that needs to be done, I think that can be done at the VA hospital. That isn't something that's life or death. But anything that needs immediate attention, I just don't think we ought to be on waiting lists. I think local hospitals, and Minnesota's got great health care. We have great access to health care. And so I think that the current Veterans Administration, veterans leadership in the state of Minnesota feels this is one of their top priorities. And we're going to be listening very closely to that.
And so given that, Mr. Chair, as all of this unfolds throughout the coming months, what do you see your role? Is there any role for the state in working with the federal government, with the VA, to try to tighten up some of these inaccuracies, some of the issues that are going on?
Well, we're going to be watching very closely, and I think the cat's out of the bag. I really don't think that the federal government's going to be able to get away with sweeping this under the carpet.
Does the state have any say, though? Can you go to the VA and say, look at what we're doing here, and we think this works?
Well, I think that we have a pretty good federal representation. I think that our congressional delegation is very strong out in Washington, bipartisanly, and I believe they'll take care of things. I'm not really worried about our Washington delegation.
Okay, and finally, encapsulate if you can, how do you think Minnesota's veterans are being treated?
I think Minnesota's veterans can always be treated better, but I think that we draw the line pretty high. I mean, I think our bar is pretty high, and we've done generally a pretty good job. We're always looking for ways to improve, but I think we've done a pretty good job.
Senator Tom Saxhaug, as always, thank you for joining us. We appreciate it.
Thank you, Julie.